Joe Mullings from One60 Studios here in Delray Beach, and today I have got a special guest with me. She's down here working or on vacation. I've got Maria O'Malley from the medtech world, and I didn't even know how to introduce you these days because you're sort of active everywhere. And well, first of all, welcome.
Yeah, thanks, Joe. Great to be here.
And you were down here pseudo work and pseudo holiday with the family?
Mostly holiday, but yeah, took a little break, get some sunshine. Still a little cool in New England. So.
And we were supposed to get together this time last year.
That's right. So we canceled our last year's trip and rescheduled it to this year.
Just to see me.
Yeah, exactly, exactly.
And you have just wrapped up an illustrious career as a major leader in Medtronic. So for our audience and the few, 2 or 3 people who may not know, why don't you share with them what you've done to date career-wise?
Yeah, so I had been with Medtronic close to 27 years, so had a number of different roles and got involved in a lot of different initiatives and led some global teams, traveled all over the globe, but decided to make a change. So left at the end of February and taken a short break and kind of looking out for my next opportunity.
Yeah, and I think you're underclubbing what you really accomplished at Medtronic. So you, probably one of the most sophisticated supply chains in all of the medical device industry. You were one of the leaders of that initiative.
Yeah, I worked in global supply chain and sourcing, and most recently in supplier diversity and responsible supply management, which is obviously a hot topic these days for many companies. Yeah,
especially with the pandemic we went through and how things are shifting in that. I mean, just from a 20,000 foot view, what are your takeaways from, the seat you were in? Moving the big pieces around, what do you think is going to be rethought in supply chain over the next few years because of what we just went through?
I think certainly, the business continuity, we had some challenges during the pandemic, just making sure we had supply to do some of the publicized ventilator ramp up, for example. And, a lot of our sources came from countries that had movement control orders and were shutting down operations. So just trying to navigate that was something that was challenging, and we were able to do that. But I think it makes us really rethink, having that, dual sourcing or business continuity so that, we have the assurance of supply and can serve our patients. So, especially when you're a company as big as Medtronic, you have an obligation to do that. If you can't serve the market, you're going to impact patients. So, Medtronic did a great job navigating it, but I think some good lessons there of really making sure you have those strong supplier relationships and also government affairs relationships so you can navigate some of those tricky situations during a pandemic, which, is new territory for everybody. We've had the hurricanes and the fires, but no one, I think, envisioned a global pandemic that was really going to have the impact it did on the industry.
Yeah. If you were stepping into a new company today, without being the voice of Medtronic, if you were stepping into a new company today, would you reimagine more onshoring here in the United States than we currently are for some of the dynamics you had mentioned?
Yeah, I mean, that's an interesting question, and I think that's gotten asked of a lot of companies, including Medtronic. I think, a lot of companies do have a global supply base, so they're not going to just pivot and move to a U.S. only. But I think some of the trends to moving to low-cost countries or globalizing it maybe will get slowed down a little bit.
Yeah.
But I don't think it's going to cause reversal of some of those decisions that were already made. And I think there's still, you can have good business continuity with a global supply base. It doesn't need to all be U.S., but I think there are good situations where having a local supplier that has good business continuity can be advantageous.
Yeah. So we're going to consider redundancies a little more deeply in regards to second, third sort of player suppliers in those areas.
Yeah, I think so. And I think, we were very focused on inventory management and cash flow and, just making sure you have that right balance so you don't cut yourself too short, that you only have several weeks of supply.
Yeah.
I've been talking to companies that, inventory is not a concern and they just want to make sure they never run out. And that served them well during this pandemic.
So you said you're talking to companies, right? So you're a free agent now, which, for almost 3 decades, you were not a free agent. And I know personally, many people thought you were top of the food chain in that sort of role on the supply chain side. So what are you thinking now? So you've got this illustrious career. You were at the top of the food chain / supply chain, so to speak. What do you think about every morning right now?
One, trying to take a break. I've been going pretty hard for that whole time, but I guess I'm also at a point too where I'm not going to take a full-time break from my career. So starting to talk to companies, small companies, medium-sized companies. So it's kind of all over. Looking at maybe even setting up my own company. I set up a small LLC and exploring that option a little bit to do maybe some consulting work. So, I mean, I'm finding just having the time now to spend and learn about all these new companies that are out there and the technologies and what's happening is pretty exciting. My husband said that to me, take the time and learn. Now you can learn what all these cool companies are doing. So that's pretty interesting. And, I have a nice network through MassMed. So talking to a lot of those people that are everywhere from startup to mid-sized companies or large companies.
And you led MassMed, right?
I did, for the last 2 years.
First female,
Yes.
right?
Yeah.
And you've been active in the female leadership, well, leadership in general, but especially women in medtech with MassMed.
Yep.
And you've always been super active in making sure there was totally fair consideration given across the board in female leadership in medtech.
Yeah, that was one of the nice things when I left Medtronic. A lot of the women leaders were very complimentary, the younger professionals, and just complimented me for paving the way a little bit and helping them, find their way in their career in what has been a very male-dominated industry, but I think it's changing. So I think programs like Women in MedTech is a great forum for women to really network and get that support and mentorship.
And you, as the lead of MassMed with Brian Johnson, I think that organization did amazing things during the pandemic. The pivot that took place, the town halls, what did you and Brian think about and the leadership team think about there? Well,
MassMed was a big networking organization, and a lot of our events were in-person events, which we couldn't do. So, I have to give a lot of credit to Brian to being one of the first ones to do a Zoom town hall and really quickly change, how we were going to support the industry. And I think, being in a pandemic is one of the best use case, examples of why, an organization, advocacy organization like MassMed is so critical during that time. And we had almost weekly town halls with lots of different content. We had a Women in MedTech series, which we're starting up again, and incredibly well attended. And not only that, but developed an organization to help get PPP to companies and hospitals. I mean, just the value that they provided was tremendous. And we actually gained membership because people recognized the value of it.
Yeah, and I know early when it first hit, I sit on the board with you, and I was on the phone with Brian thinking through what are we going to do, and Brian immediately pulled out all the stops you did as well and connected the right manufacturers, let's call out Boyd Technologies, right?
Yeah.
Matt Boyd and the team there. That's just an example of the power of MassMed and what you've built over there with Brian.
Yeah, it's a nice network of people and really connected those right people together. So, and even people reached out to me that I knew through industry that were like, what's this about MassMed? And immediately signed up to be part of it. I mean, membership is relatively inexpensive, but they got, tremendous value out of joining.
Yeah. So let's go back to the women in medtech. And there aren't enough female leaders, first of all, in medtech. And some of that is due to just historical male leadership across all industries, not just indicative in medtech. Some of it has to do with biology. There's family started, right? And sometimes you have to take a break and don't go back. And then sometimes there's the, who do I look up to? If I'm a female, I don't have, sort of an avatar to look at in that lead. So I'm a young person. Let's not even make it male, female. Let's first start out. I'm a young person looking for mentorship. You and I chatted beforehand. You continue to seek out mentors based on pockets of decision making that you're going through. So what's your guidance? Do you have one mentor that should guide you through everything, or should you have a series of mentors that have an expertise and a leverage point and a point of view that might be unique across the industry?
I don't know. I always think it's great to have a board of directors that helps you and have a number of mentors that can give you advice and different perspectives. So I don't know if I necessarily have one. I had one probably earlier in my career. And I think a lot of companies try to have that, program that we're going to assign you a mentor. You really got to figure out who you're going to fit with nicely and who you're going to have a good relationship that can give you that career advice and guidance. But I don't necessarily think it has to be a one for one relationship. And a lot of the people that I mentor, I encourage them to talk to other people, whether it's an ongoing relationship or just a quick check-in to get their advice. I've done that myself as I'm thinking about my next career move. So I've talked to a number of people that have different perspectives and what, do they think would be a good fit.
Yeah, you and I had a great session on a Saturday morning
We
for
did.
quite a while. And, it's great because, when I can give back, you've given to me, in fact, you provided me with the opportunity for the keynote at Medtronic, which I think is probably the first time a headhunter ever did that. And that was fun. That was fantastic. And whenever we can return those complementary behaviors just as partners in the industry. So one of the things about mentors, and I love your thoughts on this after such a fantastic career to date in medtech, we tend to only look for mentors in the workplace, when realistically the engine that drives us is our own personal development. And to me, careers are definitely important, but a career only really takes off if you're personally working on yourself.
Yeah.
So what are your thoughts on that and your guidance to some of the emerging people in industry? Personal development and career development, do you manage them differently?
Well, I guess I'll say for myself, I've always been career focused and didn't have that necessarily personal balance. So for me now, it's a good time to hone those skills a little bit more. Yeah, I think you can have both. I think having good mentors within your profession or within your own company is always helpful, but to get an outside perspective can be good too. And they're a little less biased too, so they can kind of give you their perspective and not be, a little less partial than someone that's actually in the company.
The world of supply chain, I think, is an underestimated impact on the ultimate impact on the patient, right? So we talked about a little bit about Medtronic and all medtech's responsibility to that. So I'm a young startup. I'm up in Boston. I'm a first or second time CEO. And what are the things that I probably don't realize that I should know about supply chain? So why should I have a consultant at a very high level come in, even from a cursory check-in on what are you doing? Right now I'm at prototype stage. What am I not thinking about that I should be over the next 2 or 3 years?
Yeah, I've actually talked to a number of companies that are, they're all about the technology and they're, amazing engineers that are working on the next device that's going to be a breakthrough technology, but they're working with, they just don't understand the supply base. So they're working with the very few that they know, but they're not thinking about if they're ever going to get, when they get to FDA approval or commercialization or potential acquisition, they have to have a pretty secure supply base to make them attractive or viable. It can be, if they can't get supply for prototypes or even clinical runs, that's going to be a challenge. And they want to have, reputable suppliers. It can be an Achilles heel if they don't have that right. And I've talked to a lot of them that are, new companies or, startup companies, and it's just not a consideration. Or they'll hire, a head of operations who doesn't have supply chain, supply management experience. So I don't think it's necessarily a full-time requirement, but it's something that they need to consider. I met with a company last week that, is just getting into clinical trials, and they're being looked at by Medtronic and other companies, and what they're looking at is their supply base. That's the part they went really deep on. And, they did a good job with it, but, I think they admitted part of it was good luck. They hadn't really thought about it, and they were they've approached me if I'd be interested in talking to them, just so they really have a more robust process of vetting out suppliers and putting them on their approved supplier list. That's just not part of their thinking when they're at that stage.
Yeah, and it's hard to do because once you're locked into a supplier base in that prototype stage, you pretty much put your head in a pillow like, I'm good, I'm covered there.
Yeah.
And somebody's got to look at the long tail of that risk, because when an acquirer comes in, we're just learning now that, not just now, but some are learning now how important that quality system is when the company's coming in an acquisition, and the amount of remediation that occurs oftentimes when you have to come back and clean that up. And I'm supposing that the same thing could be true on the supply chain side of things.
Yeah, the switching costs are huge, and once you've locked in a supply base, and it's part of your regulatory filings, it's really hard to change it. It's very expensive, so you got to get it right.
And so if I'm a startup, and again, this is the advice, people, listen to me here, right? So I know I sit on a couple advisory boards to startups for me to just oversee what they're thinking about in regards to their hiring. What should I be doing? What shouldn't I be doing? How do I get best athlete? You know, I don't need a full HR function, but Joe, what do you think, right? And so that would probably be a role that would be important for a startup to think about, and having somebody on their advisory board, or at least as an advisor from a supply chain perspective of what am I not thinking about that I should be.
Yeah, I think that's right. I mean, those companies have a lot of smart people and they figure it out, but they might be well served to have someone that's got that experience help them out.
So finally, I am graduating from university. I've got a couple options in front of me. I can go to big tech, I can go to media, I can go to medtech, health tech. What should I know about medtech, health tech from a career trajectory perspective that may help me evaluate whether I want to do this for the rest of my life or not?
Yeah, I guess you got to think about, you know, what your passion and your interests are. For me, I don't think I'll ever leave medtech. I like the patient side of things and helping people. You know, Medtronic had a great mission and very patient focused. And a lot of companies I'm talking to have that as their, you know, guiding true north. I do think you got to think of, you know, what are you going to feel good about? You know, I have a daughter who's a biomedical engineering student. She's in the biotech space and healthcare, and you know, I think those are great careers. It's going to continue to grow. I think there's a lot of opportunity out there. I don't know. I just think it's interesting. I worked in high tech very early in my career, and I just really didn't even understand the end product. And you're doing a job versus you work in med device, and it's, you know, you're doing something that's going to improve patients' lives.
Or save them.
Yeah,
Yeah.
exactly.
Yeah. Well, thanks for taking time out of your holiday and coming down finally and us getting together in my stomping grounds instead of up in Beantown.
Yeah, very good.
Thanks so much.
Yeah, thanks, Joe.
This is Joe Mullings from One60 Studios. Be well.